Hi, everybody. I'm Dr. David Geist. I'm really excited about opening our new office in Worcester. I'm going to be there performing skin cancer surgery. I'm a dermatologist. I have special training as a skin cancer surgeon. This means that after completing my dermatology residency, I did an additional year of what's called fellowship training, specializing just in skin cancer removal and management and the reconstruction after the removal. Mohs surgery is one of the primary skin cancer removal techniques, and the fellowship is focused on that. I've been doing that for over 10 years. Mohs surgery is a technique that we use for skin cancers that are located in cosmetically and functionally sensitive areas of the body, such as the face, head, neck, hands, and feet. We also use it for tumors that are large or aggressive so that we can trace out all of the parts or fingers of the cancers as need be. You can read a lot more about Mohs surgery on our website and also on the American College of Mohs Surgery website, which has some great resources. Tonight, I want to spend some time talking about my approach to skin cancer patients, what it's like to come in and meet with me and my team and have a skin cancer surgery. I find that a lot of patients coming in for the first or even the second or the third time can be pretty nervous. And I have a really wonderful, kind, expert staff, and we try to put you at ease coming in to be with us. You're going to be with us for a couple of hours typically, though the surgery is not going on all the time. You're sitting and waiting. One of the things I like to do first is just sit with you and look at the pathology report so we can talk about the skin cancer and answer questions that you have about it. Most of the Mohs surgery skin cancers are basal cell skin cancers or squamous cell skin cancers. These are chronic sun damage skin cancers from sun damage built up over all the years. A common question I get is, do these skin cancers turn into melanoma? And the answer to that is no. And then we want to talk about the treatment options. Typically, your primary dermatologist has sent you to me because they think Mohs surgery is a good option, but sometimes there are other options to consider, and we'll talk those through. They range from some creams or scraping or sometimes even radiation treatment. And I want to make sure that we're going to do the right treatment for the right patient for the right cancer. Assuming that we do want to proceed with Mohs surgery, we'll talk that through in some detail. I should also mention that some of my more mature patients, it's a really great conversation to have about whether it makes sense to do surgery, and there are certainly risks to not doing it, but I do want to make sure that what we're going to do is in the best interests of each patient and their values, the family's values. So we'll have that conversation when needed. We'll talk a little more in detail about your cancer, how aggressive it is, what to expect from the surgery. The average with Mohs surgery is that we take a stage and then you sit and wait while we process it. And it's about 45 minutes to wait. The average is to go twice. Sometimes it might just be once. And sometimes it's 4 or 5, or last week we had one that went 6 times because there was just more cancer under there than met the eye. But that's the great thing about Mohs surgery, is being able to trace out the cancer and make sure we can remove it all and get the best cure rate, which is 98 to 99%. In the beginning and then later, once the cancer is removed, we'll spend time talking about how we're going to fix the area or get the area to heal, the reconstruction of the area. Depending on how complicated the tumor is and the location on the body, there are lots of different approaches that I can offer that we can discuss to see what's, again, going to be the best for you as the patient for this area, and what's going to fit your life, your values the best. Sometimes it's a simple closure. Sometimes it might involve a skin graft where we borrow some skin. Sometimes it might involve a skin flap, which means making some additional incisions locally and moving skin into place. And sometimes things will heal in on their own, and that might be the best option for someone. We'll talk about how there's always going to be a scar. The goal is to trade the cancer for a good looking scar. Scars tend to do better as the months go by, so it's important to have that expectation up front that there's going to be a process, and we'll go through it together if need be, and there are things we can do to tweak scars as they move forward in time to try and get the best result. I always want to be there with you to get the best result from your scar. Another thing that we'll talk about early, middle, and late in the visit is what the activity restrictions are after surgery. This can be a lot of delicate surgery in areas we want to have a really great outcome. About a third of how the surgery turns out cosmetically probably has to do with my handiwork. About a third of it is definitely up to the patient. You need to restrict your activity. You need to be prepared to restrict your activity for days, sometimes a week, sometimes more, from exercise, from chores, sometimes from work. Sometimes it's really sitting around at home to get the best result for the long run. And we'll go over that with you and make sure we're on the same page about that, and that what we're going to do is going to fit into your life in a way that's going to get you a good outcome. And then my staff's really great about getting you bandaged and going over all the details about how to take care of the area going forward. We're always there to help by phone, or if you need to come in and have us look at something or change a bandage. We just want you to have a great outcome. So that's a lot of what to expect when you come in to have Mohs surgery with us. We're a nice bunch. It can be a lot to go through for people, and we understand that. And we're going to be with you every step of the way. So again, I'm really excited to be coming to work in Worcester, which is my hometown, and I look forward to meeting folks and helping you out. And now I'll be happy to answer any questions that come up. Yeah, I mean, that's a great question. There's no set age. It's really important to work with your primary doctor and see what kind of, specialist care is going to be valuable for you. If you're someone who's had a lot of sun damage, beginning in your youth, then it's not too early, especially if you're fair skinned, to get in your teens or 20s for a skin check. Likewise, if you have a lot of moles, you may want to have them evaluated at least once early on. Could be in childhood, could be teenage years, to just see if any of them have concerning features to be monitored. If there's a family history in particular of melanoma, which can have a genetic predisposition, that's a recommendation that everyone who's a first-degree relative to that person gets a skin check as a baseline at some point. It's really, the question is, should I get a skin cancer screening, every 6 months or every year? It's really individualized for each patient, and not everybody needs a skin cancer screening. Patients who've had a skin cancer should absolutely get, at an absolute minimum, a yearly skin cancer screening. And then we typically recommend, when you've had a recent skin cancer, that this be at least every 6 months. And if you've had a recent melanoma, the recommendation may be every 3 months. But it'll be something individualized, with your dermatologist based on your situation. Yeah, this is a great question, and this goes to one of my favorite topics, which is telling you all the things that you can't do. So you often go home from Mohs surgery, almost all the time, with a big pressure bandage, and you got to go home and you got to just sit there and not do much. And that means you're not cooking dinner, you're not cleaning, you're not doing chores, you're not running errands, you're not taking the kids to soccer. You really want to let your body rest and let the stitches rest and the wound rest, so that everything's going to heal up smoothly. Because if you're real active, you can bleed, you can rip a stitch, or you can just kind of traumatize the skin between the stitches, and the skin can die. And then the scar doesn't heal well. It takes a lot longer. It doesn't look as good. So, I recommend planning days to at least a week. And sometimes we'll talk about even longer, that you have to be on very light activity. And then once we get out past that point, you can start to get back to your normal activities. But I certainly don't recommend any big adventures or travel coming up right after your Mohs surgery, it's almost always better to schedule it after you have activities coming up. Mohs surgery has so the question is Mohs surgery a permanent solution in the sense of a cure? And for an individual cancer, Mohs surgery typically has a cure rate of 98 to 99%. So that's one of the higher cure rates probably in medicine. There's a small risk of something growing back, and certain cancers, more aggressive cancers or recurrent cancers, might have a slightly higher recurrence rate than that. But for that individual cancer, we're going to consider the Mohs surgery to be a really good chance that that one's never going to come back. Unfortunately, for folks who've had a sun-damaged skin cancer like basal cell or squamous cell skin cancer, we would estimate that in the next 5 years, there'd be about a 40% chance that you're going to have another different local sun-damaged skin cancer somewhere due to your overall sun damage burden built up over all the years. So my team and I get a lot of repeat customers who we love to see. I don't know that they always love coming back in with us. I mean, I think they like us okay, but. Great. Well, it's been a pleasure talking with you all tonight. And similarly, while I hope I don't have to see many of you, I'll certainly look forward to helping you out when need be.